Hello there everyone, welcome to your colorectal health and wellbeing video. My name is Gemma Yoon and I'm the Assistant Macmillan Health and Wellbeing Coordinator at the Ulster Hospital. So what is this video about? Well, from speaking with patients and their families, they tell us that whenever they have completed a certain portion of their treatment or finished their treatment, it can be a very difficult time to know what happens next and who you can talk to. So we recognised that this can be very difficult and that there was a strong need for information and support, not just about clinical follow-up, but also relating to the broader issues associated with recovery. This can be anything from practical issues such as finances or returning to work, and also things like dealing and managing with emotions. So this video is our way of coming together to remind and reassure you of all of the support that's available in the system and how you can get in contact with us. So this video is going to help you learn more about follow-up, what to expect, who to contact and when to do so, and you'll shortly be hearing from some of our healthcare professionals as well. So we have our consultant colorectal surgeon, our clinical nurse specialists and dietitian as well. It's also an opportunity for you to find out about some of the information and support that's available to you during your recovery or living with a diagnosis. I work for the Macmillan Health and Wellbeing Service alongside our coordinator Karen Kelly and our support worker Nicole Stewart. There are a wide range of supports and services available to you through ourselves, also the South Eastern Trust and all of our partner charities. These can help you live really well with and beyond your diagnosis, and our service can help you explore all of that. We understand that no two patients or families have the same experience of cancer, and what works for one may not work for everybody. But there are these common themes that tend to emerge, such as navigating the health and care system, facing practical issues such as transport, finances and benefits, and also things like fatigue, building your strength and stamina, even dealing with the emotional impact of a diagnosis and the effects that that can have on your self-esteem and self-confidence. Worries about work and talking with your employers and knowing your rights at work, but also support for the wider family and any children or young adults as well. It's important to recognise that you're not alone in coming up against any of these areas, that these are very common things and that there's lots of help and support out there for you. So this video is really about giving you a chance to review things, seeing if there are any areas of your life that can be improved and helping you take ownership of your recovery and your self-care and starting to put some pieces in place that are going to help you live really well with and beyond your diagnosis. So with that in mind, the next person you're going to hear from is our consultant colorectal surgeon, and that's Miss McGee.
Hello, my name is Kathy McGee. I am one of 7 consultant colorectal surgeons in the South Eastern Trust. You can see us all here in a list, and hopefully at least one of those names is familiar. I'm going to talk a little bit about the treatment of bowel cancer and then move on to what happens next. Everyone attending the meeting will have had a different, unique experience of finding out a diagnosis of bowel cancer and making it through your treatment. The most commonly recommended treatment for bowel cancer is surgical removal. So a lot of you will have been through a major surgical procedure, which may have involved the formation of a stoma. Others may have had radiotherapy as the primary treatment, and sometimes this can result in a complete response, meaning that the tumour has been destroyed and surgery may not be necessary or it can be delayed. After your primary treatment, additional treatment with chemotherapy may have been recommended or discussed with you. There may have been more surgery to reverse a stoma, for example. Some of you might still be waiting for that. And a small number of patients may need referral for the treatment of tumour deposits in the liver or lungs, which can be either removed surgically or ablated, which means that they are destroyed by inserting a wire into the centre of the tumour and applying energy to it. Once the treatment phase is over, there will be a schedule of surveillance, the purpose of which is to monitor your recovery and progress and to identify and manage any side effects of the treatment. We also want to look for any early signs of disease relapse and to detect any new bowel polyps or even tumours at an earlier stage. The side effects of treatment are wide-ranging, and I have just included a selection of the most common things. Please don't hesitate to mention any symptoms or any concerns that you have to your consultant or key worker. Believe me, we have heard most things, and there could be a simple technique or treatment available to help you. Lots of people after bowel surgery will have trouble with looser stool, more frequent movement of the bowels, loss of warning about movement of your bowels, and even leaks. There are lots of things we can do to help you, so please discuss it. When you attend for your surveillance appointment, we will ask you how you are and about some specific symptoms. There may also be a physical examination, but often now we are contacting you by telephone for these reviews. We will check a blood test called CEA, which is a tumour marker and can give us an early warning system for disease relapse before symptoms develop. There will also be planned CT scans at year 1, 2 and 3 after your primary treatment. And the bowel camera test, the colonoscopy, will be done at 1 year and then 5 yearly thereafter. This may be more often if you've had a lot of polyps in the bowel. If you had a rectal cancer that responded to radiotherapy and did not have surgery, you will be in a specific watch and wait programme with extra camera examinations of the tumour site and MRI scans. When are you signed off? Well, routinely, we would sign you off after 5 years if your follow-up has been satisfactory. You may still have camera tests ongoing after that. Some patients may be discharged earlier than that by mutual agreement if no further treatment would be beneficial or if other medical problems become a priority. This is the last slide, and it's just to highlight some of the warning signs or alert symptoms that we would like you to report as early as possible. When you're coming to your appointment, think about these things. Please report them at your appointment. But if it is a long time till your next appointment, please contact your GP or your key worker at the hospital to mention any of these things, because you may need an examination or investigations to be arranged. Thank you for listening, and I will hand you back to the Macmillan team.
Hello, my name's Sarah Christie. I'm one of the colorectal nurse specialists here at the Ulster Hospital. You're very welcome today to our colorectal health and wellbeing event. As you can see, I'm one of 6 colorectal nurse specialists. You may well have met me or many of the girls on the team: Martina, Jacqueline, Lisa, Tracy, Angela, who's currently off on maternity leave, and Una Mairead. This is an old picture. We need to get a new one. Hazel, I'm sure some of you may have met Hazel, has now retired, so we need to get a new picture. That's on our to-do list. So today I'm going to be talking a bit about our role within the colorectal service, your follow-up care and how that is planned, and how to access the service. I'll also be talking about your health and wellbeing event today and your holistic needs assessment appointment. So our role is really quite varied. We are down as your key worker. So that means we're a link with all members of the colorectal team. We have advanced clinical knowledge within the area of colorectal cancer, colorectal disease. So we can tell you a lot about your diagnosis, your surgery, what's going to happen in your time in hospital, and your aftercare. We do have good communication skills. We're used to talking to patients, to families, to other professionals. And we have leadership skills working within the multidisciplinary team. And that's a meeting that's held every Wednesday, and your case will have been discussed at least twice. Whenever you were initially going for your investigations, and your case would have been brought forward and the decision for your treatment was made at that time. And then after your surgery, the decision on your aftercare is planned. We're an ongoing point of contact for you before, during and after your treatment. Other than the information that I've mentioned that we're able to give you about your cancer and your diagnosis, we can also give you lots of practical advice, and those patients who have had a stoma will probably avail of plenty of our time whenever you're in hospital and perhaps afterwards. And in addition to all the information, we're here for emotional support, and we can signpost you to those patients who need extra support, and that can often be through the Macmillan team. We are part of your cancer follow-up, and you will see us in the years after your diagnosis in your follow-up clinics. And we provide you with a holistic needs assessment appointment, and many of you may already had that appointment. So as you can see how the cancer follow-up is set up. At the bottom there, you can see the multidisciplinary management. So the decision on your treatment and your aftercare is based on that combination of specialties: self-directed aftercare and shared care. So self-directed aftercare is for those patients who have an early cancer and they do not require additional follow-up. So you'll have an initial appointment after your surgery with your consultant. Then you'll have your holistic needs assessment appointment with the nurse specialist around 6 to 12 weeks. Might be a bit later, and then at that time you'll explain that you're being discharged to self-directed aftercare. So we're putting a bit of the onus back onto you and how you can access the service should you have any concerns. But you don't need CT scans and blood tests. However, you still get colonoscopies, and they will continue every 5 years. And we want you to know the alert signs if you have any issues, and I will be talking a bit about those later on. And of course, you're invited today to the Health and Wellbeing Clinic, and the access to the clinic is ongoing. Cancer follow-up. Your cancer follow-up is set by regional guidelines, and generally it's a 5-year follow-up protocol. It's shared with your colorectal surgeon, the oncologist, for those patients who've had chemotherapy and or radiotherapy, and also with the colorectal nurse specialist. Each appointment is a clinical assessment. It's how you're doing. So we want you to tell us how you're feeling, and for you to tell us any issues or concerns that you want to bring and highlight with us at the appointment. In addition to that, we'll carry out a blood test, and it's called CEA, and that's a protein that's released in the bloodstream and is an indication that things are going along well, hopefully. We also order your CT scans, and they're repeated after year 1, 2 and 3, or sooner if there's a new issue arises or you're under the care of the oncologist. We ensure that you have your camera test, your colonoscopy, and that's after year 1, 3, and then again every 5 years thereafter. I know they're not pleasant. We do refer you to other resources if at that appointment it's felt that that is required. These appointments are now both face-to-face and telephone, and we have had to change the way we work in view of COVID, but we do endeavour to see you if there is a new issue. Access the colorectal service. So between your appointments and your scans and camera tests, you may develop new concerns or issues. And unfortunately, as you may have experienced, appointments can fall behind. And unfortunately, this is what has happened in all services due to COVID. But we are happy to discuss any issues or concerns that you have. And if we can't deal with them, it may be a simple issue or a practical issue, or may just simply need to speak to the secretary to find out about your appointment. If not, we may well need to refer you on to other services. But what we do really want to hear about are red flag symptoms. So do you have a new pain or a lump? Is there any unexplained weight loss, a change in your bowel habit or from your stoma output, blood in the bowel motion, or an increase in tiredness? Looking at your holistic needs assessment appointment, as you can see, we're looking at you as a whole and every aspect of your life. The appointment is to attend one of our our team, the nurses, you will be sent out a concerns checklist, and this could be done online as well. And that's to prompt you with any new issues or concerns that you have that should be addressed at this clinic. It's an opportunity to discuss your entire cancer journey and how this has impacted on your life and indeed the life of your family and friends. It's meant to be less of a clinical appointment. And again, we're looking at resources that are available to you. Should that be Macmillan? Should that be exercise? Any number of things that we need to address, or even you could be having ongoing problems from the side effects of your chemotherapy. We want to address those unmet needs. Can't guarantee we can resolve all your problems, but we'll certainly want to talk about them. We want this to be some health promotion. So we want to promote a healthy lifestyle. We want you to stay well. Again, looking at exercise, looking at stop smoking clinics, looking at complementary therapies, reducing your alcohol intake. We want to, this is a means of support to you over and above all your clinical appointments, to offer you and your family and carers support. Today's health and wellbeing event, well, hopefully this has tied everything together and it has formed part of your recovery. As I've pointed out, we're looking at promoting healthy lifestyles, and along with that, hopefully we've educated you a bit as well about both your cancer and your ongoing care and follow-up. And the other resources that you'll hear about today that are available. And whilst you've watched this today at home, there are lots of other patients joining in today, and you're not alone. So thank you very much for today. I will be happy, along with my colleague Jacqueline Blair and Miss Kathy McGee, to talk to you after the presentation if you have any issues. Thanks very much. Bye-bye.
Hello everyone, my name's Fiona and I'm one of the health development dietitians here in the Trust, and today I've got a very short presentation on eating well after cancer. This is a group session, so when giving general information, it's really important to note if you've been given specific advice about your diet by a dietitian or a specialist nurse or a doctor, then do please continue to follow that information because it will be specific to you. If you'd like any further advice on a one-to-one basis, then you can ask your specialist nurse or your doctor to send through a referral to the dietitians. Why eat a healthy diet then? So there's growing evidence that if we eat a healthy diet and if we're a healthy weight and are physically active, then you can help to reduce your risk of getting cancer again and help to improve your overall health. There actually isn't enough evidence to make specific recommendations about what people should eat specifically to prevent a certain type of cancer coming back though. So that's why the information I'm going to give is general healthy eating information today. This is probably very familiar to everybody. This is the Eat Well Guide, and the Eat Well Guide divides the foods we eat and drink into 5 main food groups. So we should try and choose a variety of different foods from each of the food groups just to give us all the nutrients that our body needs to stay healthy. You'll see the biggest groups then are our fruit and vegetables and our starchy carbohydrates. We need some protein foods as well, then a smaller amount still of our dairy and alternatives. Very small slice, the very small amount of unsaturated fats then that we would have. And I'm going to go through each of these food groups in turn. So our fruit and vegetables, so we would aim to have at least 5 portions of fruit and veg a day. We'd want to eat a rainbow there because different coloured fruit and veg gives us different vitamins and minerals and antioxidants. Fruit and veg also gives us fibre, which is important too. So try and get a variety of different fruits and veg when you're going for your 5 a day. Doesn't just have to be fresh, it can be frozen, it can be tinned, it can be dried. Try and get that variety in. They're great foods to be taking, and that's a public health message that we're really well aware of. In terms of what actually a portion is, I would say very roughly it's what you can hold in your hand. So 1 apple, or if you think about smaller fruits, well, kiwis would be 2 kiwis would be a portion size. It could be some frozen veg, so about 3 heaped tablespoons of frozen veg would count. It could be a small handful of grapes. All of those would be portion sizes. If we're thinking about dried fruit, then it would be slightly smaller at about a tablespoon. And we can count smoothies or fruit juices, but just up to a maximum of 150 mils once a day would count as a portion size for those. Our starchy foods then, so these are about 1/3 of our diet, and these are great at giving us energy. So unless you've been advised otherwise, you should try and choose higher fibre options such as wholemeal bread, wheaten bread, breakfast cereals that are labelled as high fibre. We could go for brown rice, wholemeal pasta. Fibre is good because it adds bulk to our diet and makes it more filling, which is helpful if you're trying to manage your weight, trying to lose weight. Fibre also helps us prevent constipation. The soluble fibre that you would find in oats and in pulses can help us control our cholesterol. If you are increasing fibre, I would say just do it very gradually increase your fibre. And if you're increasing fibre, it's really important to make sure you're taking enough fluid. So making sure you're taking 6 to 8 glasses of fluid. And the fluids can be water, tea or coffee, milk, diluted squashes. The one drink that doesn't count as fluid is alcohol. So don't be taking alcohol thinking it's a fluid. I'm going to talk about alcohol in a couple of slides' time. So dairy and alternatives, these are really good source of calcium, which is important for our bone health. And roughly we'll be wanting to have about 3 portions a day. A portion is about a 200 ml glass of milk or a small pot of yogurt or a small matchbox size of cheese. Try and go for the reduced fat versions, so your reduced fat cheese or your lower fat yogurts. In terms of your milks, go for the 1% or the skimmed or the semi-skimmed milks there. If you don't like cow's milk, then go for the plant-based milks. So that could be oat milk, it could be rice milk, or it could be the products made from those. Just make sure that it says on the nutrition panel that it's got calcium added into it, that it's fortified with calcium. Beans, pulses, fish, eggs, meat and other proteins. So like it would suggest there, these are good sources of protein. They've also got vitamins and minerals. Beans and lentils are really good alternatives to meat, those pulses, beans and lentils, because they're low in fat, high in fibre. They're quite cost effective too, and they're a really good store cupboard item to have in your house. So we should definitely consider having those. We would include fish in this food group, so try and have 2 portions of fish a week, one of which you should go for being an oily fish. So oily fish are fish like salmon or mackerel would be oily fish as well. In terms of our meats then, we should try and choose leaner cuts of meat. So you could go for your poultry, so your chicken, turkey. If you are going for red meat, then go for remove any visible fat from it before cooking. And if you're choosing something like mince, then look for the lower percentage fat that you can see in the shop. Go for the lowest one that you can afford. You can also use cooking methods that would reduce the fat down. So grilling, steaming, baking, microwaving would all be good ways to cook which are lower in fat rather than frying. Just looking then at our red and processed meats, these are actually foods that we should limit in our diet. So red meat might be our beef, lamb and pork. So it can be part of a healthy diet, but actually eating a lot of red and processed meat potentially puts us at increased risk of bowel cancer. The processed meats then would be meats that have been preserved by smoking, curing, salting or adding preservatives. So that could be sausages, bacon, ham, salami, pâtés. What the advice would be is that if you're taking more than 90 grams a day of cooked weight of red or processed meat, then you should try and cut it down to no more than 70 grams a day, or you could look at it over the course of the week being no more than 500 grams across the week. To give you a bit of an example about what different weights of meat would look like, a slice of ham is about 23 grams and a quarter pounder burger is about 78 grams, whilst 90 grams would look like about 3 thin cut slices of roast beef or roast lamb or roast pork. Our oils and spreads then, though that I said that those are the smallest slice in our food groups. We need some fat in our diets, but just a very small amount, and it's better to choose the unsaturated spreads just in terms of our heart health. So that will be rapeseed oil, vegetable oils, sunflower oils, olive oils, and the spreads that are made from all of those products. Butter, coconut oil are all high in saturated fats, so I would suggest avoiding those. If you do use them really sparingly. And in fact, all fats are high in calories, so all fats should be limited, so use very, very sparingly. Outside of our Eat Well guide, then you'll see it's not a food group, but these are our foods high in fat and salt and sugar. So our chocolate, our crisps, our buns, our biscuits, all the foods that we love. They're not any extra benefit to us. They don't give us any extra nutrition. So that's really, if we do take them, we should only eat them in small amounts and less often would be the advice that I would give there. Try and limit them as much as possible. What you can do is go for the other food groups if you're trying to think of snacks. So try and think of snacks from your fruit and vegetables, or your starchy carbohydrates, or your protein foods, or your dairy foods. Try and think of those 4 food groups as snack foods to pick, and avoid any of the foods that you would find here as a snack, because really we do want to limit these down, because we don't want to be taking high intakes of sugar or fat, particularly saturated fat. High intakes of fat and sugar can increase our calories that we take, and if we take more calories in than we use up in our activity, that's how we can gain weight. Alcohol then, so research shows that drinking alcohol, irrespective of the type, is a cause of cancer, particularly cancers of the mouth, throat, esophagus, bowel, liver and breast. Alcohol is also high in calories, so if you're trying to watch your weight and trying to reduce your weight, then reducing your alcohol intake could be something to think about there. For anybody that does take alcohol, the Chief Medical Officer would suggest that you take no more than 14 units across a week, and you can't save them all up and have them on one day. You want to have some alcohol-free days. Roughly 1 unit would be what you would find in half a pint of beer. In terms of pub measure of spirits in this country, you would find about 1.5 units. So just be mindful about the amount of alcohol you're taking. Being a healthy weight actually helps to reduce the risk of cancer recurrence or developing new cancers. So looking at your waist circumference can be a really helpful way to measure that. So no more than 32 inches for women, no more than 37 inches for men. Try and follow the healthy eating Eat Well guide principles if you're trying to lose weight and you really just want to look for 1 or 2 pounds a week weight loss. I've got a good website that will go into a lot more information for you that I'm going to show you at the end now. Just then, a couple of other aspects that people think about in terms of maybe they would ask us about cancer and healthy eating and whether they need to think about these things. So superfoods, really, superfoods is a bit of a marketing term and no one food is going to be beneficial. We need to have a balanced diet. A balanced and varied diet, like I've talked about in the Eat Well guide, is what we need to be doing there in terms of our health is beneficial. In terms of sugar, there's no evidence that sugar directly causes cancer or that it directly encourages cancer to grow. But if you think back to the Eat Well guide, in terms of general healthy eating, we should actually try and limit the amount of sugar that we take because sugar is calories and extra calories then could potentially lead to weight gain. So that's where we should be mindful of our sugar because it could be leading to weight gain and it's not part of healthy eating advice then to be taking high amounts of sugar. Vitamins and minerals then, so you should be able to get all the vitamins and minerals that you need from a healthy balanced diet that I've talked about in the Eat Well guide. The one exception to that is vitamin D, because most of our vitamin D is made by our skin being exposed to sunlight, and because of where we are in the world, we don't get very strong sunshine during the winter months. So the Public Health Agency would suggest that we consider taking a vitamin D supplement of 10 micrograms from the start of October until the end of March. And you can speak to your pharmacist about what ones they have in stock that you could buy over the counter there. If you're somebody that doesn't get out very much during the summer months, then speak to, then you would need to speak to your pharmacist and get a vitamin D supplement that you could take every day of the year. So you should consider in that case taking one every day of the year, even during the summer. And that would also apply to anybody who covers their skin because of religious reasons too. Just my final slide there is just some websites. So you might want to pause or re-watch your recording again to get a note down of these websites because you can find lots of different information there. And I've hopefully written a wee bit of an explanation on the slide about the information that you would find there. But thank you very much for listening today. And I know that's been very fast, but hopefully it's been useful for you. And do check out those other websites if you want more information. Thanks very much.
Hi, my name is Mike Brown. I'm the Macmillan Move More Coordinator for Ards North Down. My job is to help anyone with cancer get into exercise. This can be before, during, or after treatment and at any level. Exercise is important for everyone, but especially someone going through a cancer journey. Some of the benefits can be quicker recoveries after treatment, help managing side effects of treatment, and can provide a great social aspect to meet new people who may be going through a similar journey. Coming up next, we have a Move More video about our program.
Afternoon, ladies. Everybody fit and well and ready to get active? Excellent. Let's get going. At present, 63,000 people are living with cancer in Northern Ireland. That means that 1 in 2 of us in our lifetime will be affected by cancer. Physical activity is often referred to as a wonder drug. It can help combat the side effects of cancer treatment. It can help reduce the occurrence of long-term health conditions and can also help reduce the chance of the cancer spreading and returning. We also know that physical activity and exercise is safe both during and after most types of cancer treatment.
I was diagnosed with cancer in December 2015 with lymphoma. I was a very keen cyclist, very fit. During my journey I put on quite a substantial lot of weight, from 15 to 23 stone. I got involved with the Move More programme simply because my wife volunteered me. I then went to the class, which I realised I wasn't on my own, and I never looked back.
Move More Northern Ireland helps people living with cancer get active and stay active. Macmillan Cancer Support funds the project, working in partnership with local councils, physical activity providers, health and social care trusts all over Northern Ireland to provide physical activity opportunities for people living with and beyond cancer.
We're burning this morning. Hands and feet together. That's great, okay? We'll just do 2 more and we're back to the march, okay? This one's spot. Sometimes it can be hard to know when to start to build up your fitness after you've received the cancer diagnosis, and that's where our Move More coordinators can help. Our coordinators can provide specialised and tailored support on an individual basis to help you get back to a level of fitness that suits you. Move More is not just about the gym or running marathons. It can be any activity that suits you and you enjoy.
Well, I'm David, and I was diagnosed with a brain tumour just over 2 years ago. We'll come here for exercise in the water, which is very pleasant, much better than exercising in the gym, I find. The water supports my weight and really enjoy it.
We have David here in the pool, and David's been swimming with us for about 6 months now. It's really helped his mobility and walking. It's not just about a gym, it's not just about classes, it can be any activity that you enjoy. It's about moving more.
My doctor told me into a test for bowel cancer. I wasn't going to do it, and I'm glad I did. If I hadn't had the operation, I'd be dead now. I've been told that. I enjoy every day. I try and give back as much to Move More, to Macmillan, friendship is absolutely fantastic at these classes.
Taking the first steps can be daunting, but that's why we're here.
You find your cradle with back further. Right.
We're here to make it easier and to make you feel like yourself again.
This could be exercise for the arms. That's it. I try and make my classes as appealing to lots of people, so I don't want my classes to be boring. I want them to come along and have a range of different activities. So we maybe do a wee bit of Chai Mi, and to warm up we could maybe do a wee bit of Pilates, exercise to music, even boxercise, and different activities that's going to cater for everybody.
But dancing does not at all feel like exercise, because you're concentrating so much on counting and following the steps, but certainly it does raise your heart rate a lot more than the Chai Mi element of the class.
You've been in the house so long by yourself quite a lot, as I was ill. So it is again the social interaction and just meeting people who are similar. It's a boost to your confidence, really.
I started the classes when I was about halfway through 16 chemotherapies. I continued here whilst I was on radiotherapy as well. For me, I remember a lady saying to me, get out as much as you can when you're going through treatment, when you're feeling well enough, get out, be busy. Stay active, and that's very much what I did.
I'm Alison. I am actually a nurse in the breast care unit in the City Hospital. Ironically, I was diagnosed with breast cancer in July. We send a lot of our patients out into the community, and I actually didn't know what all Macmillan did. So, whenever I was invited to come along to this exercise class, I mean, my eyes were opened at how much they support you and get you into exercise, and how important it is. Equally, meeting up with all the other people that are in the class.
Those with poles, just put the poles out to the front. Okay, so we're just going to rotate the left leg. Okay, and now the right
Through
leg.
Move More, Macmillan wants every person living with cancer in Northern Ireland to become and remain active. Finding the right activity makes all the difference.
The support network that you have through the hospital or through Macmillan and through the friends that you meet at classes like this, it's that gets you through.
I move better, I sleep better, I eat better, quality of life just generally improved.
Life with cancer is still life. We'll help you to live it.
Hello, my name is Julie Dorian and I'm an occupational therapist, and I work for the South Eastern Trust in the community. So some of you may have come across occupational therapy, and for those who haven't, the process of occupational therapy is looking at everyday tasks to improve independence and quality of life. By occupations, we mean the ordinary and familiar tasks that we do every day, that we take for granted until we become ill. Cancer, its treatments and the recovery period can affect our daily occupations. And today I am here to talk about cancer-related fatigue, the cause of fatigue, its impact, and most importantly, some practical measures to help continue those activities that are important to you. So have you ever felt like this? I'm sure many of you can relate to this picture. I'm very mindful that you've already sat through a lot of the slides and talks today, and you could be experiencing difficulties with concentrating. I'll discuss some of the impacts of fatigue later, but it can be a very difficult thing to describe in terms of how we feel. And I suppose I just want to ask, have you been able to tell anyone how you felt? There is evidence out there that people often suffer in silence, and they don't mention it to their family, to their friends, to their doctor or their healthcare professional. But the evidence says that fatigue can be the most debilitating, disrupting routines and everyday tasks. So what is cancer-related fatigue? Fatigue can sometimes be confused with tiredness, and we would expect that after a busy day, when we feel tired and we go to sleep, that we wake up and we're fine. But cancer-related fatigue is different, and it can be described as an unusual and persistent tiredness. It interferes with our day-to-day functioning, and it is not relieved usually by sleep or rest. It's not proportional to recent activity. I remember one lady describing feeling absolutely exhausted, and this was before doing anything, and it was at the beginning of the day. And it can be very subjective, so it's a very individual and unique experience, and everyone will experience fatigue differently. Many assume that fatigue generally accompanies illness and recovery, and as we said, and therefore they don't mention it. But statistically, it states that 70 to 100% of patients are affected by fatigue at some point in their cancer journey. And it's important to know that it is a recognised medical diagnosis. And we will talk a little bit later now about the ways in which we can manage it. So what are the causes of fatigue? You can see in this diagram that fatigue is a very complex system. And it's not only the cancer itself and the cancer treatments, but there are your emotional distress. It might be lack of activity, or it may be problems with sleep. So how does fatigue affect you? For some, you may experience mild symptoms, while others may experience severe symptoms impacting on the areas identified here. So physically, you might lack energy, or you might experience shortness of breath even after a very light activity. You might even struggle to get up on bad days. Cognitively, so those are our thought processes, you might notice that you're slower in terms of your thinking processes. I can remember one lady describing having a foggy brain and really struggled to try and concentrate on reading a book. Emotionally, you might notice that you're more irritable or you're anxious and you feel very frustrated and more stressed. You might lose interest in things that you once enjoyed, and you might feel less motivated, and you may feel sad or depressed. Socially, this might impact on roles and relationships with family and friends. You might feel too exhausted to go out, and you begin to avoid going out and socially interacting with others. Your spiritual well-being may be affected too, and you may question the meaning, purpose, and value of life. And you might even have feelings of hopelessness. So how do we manage our fatigue? So the key to managing fatigue is to recognise that it is a multi-dimensional problem. Therefore, it is most likely to respond to a combination of different approaches via the multi-professional team. So it's important to talk to your doctor, talk to your healthcare professional, talk to your nurse. They can help and try and work out the cause and how to manage your symptoms. It's important to treat any underlying causes, and your doctor can check for any medical problems that can be treated, such as anemia, pain, or depression. The non-pharmacological management of fatigue, and the remainder of this presentation will focus on this. And this is the practical measures of how you can manage your fatigue. So how can we cope with fatigue? So in this picture, you can see a child with a money box. And the idea is very similar to our energy levels. You can see the child putting all the pennies into the money box and saving them up. And when they open that money box, they have to really think very hard on how they're going to spend their money and what they're going to spend their money on. Energy is the same. You have to really think about what you want to use it on. So in order to do this, and you may have already adopted some of these principles of what we call energy conservation, the 3 Ps: planning, prioritizing, and pacing. So planning ahead, and sometimes this can be a challenge in itself, and it does sometimes take a little bit of practice, but some people find it useful to use an activity diary to plan their day and week ahead. Prioritising. Again, this will be a very individual choice and what's important to you. So what are the things that must be done and what things can wait? And even think about what others can do. And I know it's very easy for me to talk about it. And being a very active and independent person, it can be very difficult to rely and ask for help. One lady I spoke to found it very challenging to delegate tasks to others in her family. She felt that perhaps they might think that they're very lazy or that she didn't really want to let them down. But when we discussed the challenges that she was facing in terms of her fatigue and her day-to-day management, family were very supportive and wanted to assist. So pacing yourself. By pacing and spreading some of the activities which demand a lot of energy, those we call high energy tasks, we can learn to better manage our days and weeks ahead. You may be familiar with the boom and bust scenario, where you feel that on a particular day you might have quite high energies yourself and your fatigue is well managed. And then what we do is that we tend to cram a lot of high energy tasks in. And what we notice then is that we pay the price in the coming days and you're fit for nothing. So this is why it's important to pace yourself. When we're planning and pacing, remember to slot in rest breaks and also allow yourself extra time and think of ways perhaps in what you can do and something that you can do in a different way. So as an occupational therapist, we can look at ways together to help manage your day and week ahead. And sometimes it's a simple change in an activity or a small aid that can make a big difference. There was one gentleman that I worked with and he had a real passion for cooking, but he recognised that completing every meal in the day and throughout the day was just too demanding. And as an occupational therapist, I provided him with a perching stool in the kitchen, and this allowed him to conserve energy, and he was still able to continue his role. He also delegated some of those preparation tasks to his family, and one family member became his sous chef, and it just allowed him then to continue his passion for cooking. As an occupational therapist, we can keep into a good sleep routine is recommended. Keeping to a routine, going to bed and waking up at the same time has its benefits. While you might be tempted to sleep through the day, it can disrupt your sleep at night. There is some evidence that there are benefits to a short nap of around 20 to 30 minutes, but anything longer is not recommended. Exercise, which has already been highlighted, is one of the best ways to managing fatigue. And in fact, some studies show that avoidance of exercise and activity can make your fatigue worse. Your nutritional intake, so fueling the body, has its benefits. And this can be very difficult whenever you're undergoing some treatments and you have nausea or vomiting. But a dietitian can advise you if you have any issues. Stress levels. How can you manage your own stress levels? And this can be something very, very individual. For some, it's relaxation. There's many apps out there that people have found the benefits of. Finding things that are enjoyable and fun activities. Even talking to somebody how you're feeling can help with relieving your stress. Some people enjoy meditation, others complementary therapy. But like I said, it's an individual choice. And it's something that you can only decide. So if we just put this all together and we imagine our body as a human battery, if you put a lot of demands on the body, then the energy in the battery will go down and you need to replenish it. So the demands like dealing with stress, family demands, the anxieties of the have-to-dos, household demands, dropping the kids off to school, recovering from illness, and return to work. And even that voice in your head, the guilt of, oh, you haven't got that done. So we notice that our battery then starts to go down. And what we would recommend is that you don't get to the stage of having a flat battery. So in order to recharge our battery, we need to think consciously of how we're going to supply it. So things like relaxation, having a good diet and nutrition, sleep routine at night, doing fun things you enjoy. It might be something that you've never done before. Exercise and activity. And as we mentioned earlier, the 3 Ps, planning, prioritizing, and pacing. And then setting goals. So in order to increase your energy levels, you can set goals, but it's important to be optimistic and yet realistic. And your occupational therapist can help you to do that. Resources available on fatigue. And if you would like further information, you can go on to the Macmillan website. And there is information that can be accessed through booklets, leaflets, and audiobooks and recommended apps. Or just pick up the phone and give us a ring. I hope that this information has been helpful. Thank you very much.
Hello, I'm Helen Murphy, a cancer-focused counsellor. And today I'd like to take some time to explore ways to look after your emotional well-being after a cancer diagnosis. There will be time for questions following the presentation. Cancer Focus provides professional counselling across the province in each of the trusts, as well as providing a range of other support services for cancer patients and their families. These include our Family Support Service, which is for children who have a significant adult with a cancer diagnosis, art therapy, bra fitting, and our free phone nurse line. Details on how to access all of our services are on our website. Our counselling service takes place in a one-to-one, confidential, non-judgmental environment and provides a safe place to address the difficulties resulting from a cancer diagnosis and treatment. Recovering from cancer and its treatments is not just about your physical body healing, but it's also about allowing the healing of your mind, including your emotions. These are some of the typical responses which are often experienced very acutely on diagnosis and during and after treatment. A diagnosis can bring up a lot of uncertainties and questions. Why me? It brings new fears and anxieties about treatment and survival. Worry is normal, but it can take over. A diagnosis can bring low mood and sadness because of how life has changed, and it can be an extremely lonely place to be, as if no one else understands. The physical impact of treatment and surgery can result in self-consciousness and a loss of confidence. It's common to experience anger at the unfairness of the diagnosis, anger at your own body, anger at others, or at God. Any life changes we experience will need a period of adjustment. After a cancer diagnosis and treatment, it may be necessary to adapt to living with and managing a health condition. It's important to find ways to cope with uncertainties about the future. Patients face the challenge of developing a new sense of self, of accepting changes in their body or in their appearance. Patients may experience new sensations such as pain, numbness, fatigue, or the loss of bodily functions. And finding a way to navigate these very difficult changes is central to achieving a good quality of life. Patients may experience times when they feel very vulnerable. At first diagnosis, when there's huge uncertainty about the outcome of treatments. Treatments may mean depending on others for care, bring feelings of helplessness or uselessness. Even when treatment ends, patients may feel particularly vulnerable without the safety net of review appointments and regular monitoring. A recurrence or a poor prognosis often brings more fears and anxieties. There are common psychological symptoms and problems. Worrying is at the top of the list at 72%. Feeling sad is really high as well at 67%. Patients often feel very nervous. Difficulty sleeping is very common. Feeling irritable, maybe as a result of not sleeping, and having difficulty concentrating, and have psychosexual problems. Cancer brings with it numerous losses. The impact on physical and social and emotional well-being, having to depend on others more, loss of identity when who you were before gets lost in the side effects of medical treatments and hospital appointments, loss of a role or employment, maybe no longer caring for family or no longer at work, loss of self-esteem, loss of trust in our bodies, and loss of life expectancy, and at times loss of expectations about the future. The world can seem unsafe in a way that it never did before. When we experience loss of anything, we have a grief reaction and we mourn those losses. Cancer almost always brings about bodily changes, and these can affect not just how you see yourself physically, but also how you feel about yourself and therefore how you behave. The physical changes can change how we view our bodies, and our body image is connected with how we view ourselves, how we interact with the world, and how we function. Our minds and bodies operate together. Physical changes also have a psychological effect and can lead to anxiety and depression, low self-esteem from not being able to do what you used to do, adjustment problems, maybe struggling to cope with side effects of treatment, social avoidance, perhaps not wanting to cope with people's intrusive questions or gloom and doom attitudes. In extreme cases, there may be psychiatric disorders. Psychosexual problems may also be an issue. Cancer diagnosis and treatment affects the whole person. Our bodies, our minds, and emotions are all linked. Many cancers and all current cancer treatments may cause sexual problems. Estimates show that between 35 and 50% of all cancer patients are affected. These percentages are higher in gynae, colorectal, bladder, prostate, and breast cancer patients. Talking to professionals can be difficult. 72% of patients surveyed said that their sexual relationship was affected by cancer, and 66% of those felt unable to talk to their GP. This can be difficult for the patient and their partner because they may be unsure that the topic is appropriate. It may seem ungrateful or abnormal. It's not something we're used to talking about with professionals. Or maybe they don't want to bother the nurse or the doctor. For the professional, it may be that they are personally uncomfortable with the topic, or maybe they don't want to offend, or due to a lack of training or information, or even a lack of time or privacy. And finding a way to overcome the barriers to talking through these difficulties can make a huge difference. Managing stress is important in everyday life in general. This is one definition of stress. Stress occurs when there's an excess of demands over the individual's resources to meet them. If you think of a set of scales with resources on one side and demands on the other, we have a limited amount of resources. And we need a certain amount of stress to be able to meet deadlines or do exams or interviews, driving tests. But when it's prolonged or out of balance, then it becomes problematic. These are some of everyday stresses in general life. And they can range from something like having trouble with the car to going through divorce, money problems, work issues, unemployment. And none of these stop because of a cancer diagnosis. So often, the stress that cancer brings is in addition to these everyday stresses. And then there are stressors which are particular to illness. Pain and fatigue are stressful for both the patient and the carer. Trauma, because anything perceived as potentially life-threatening is traumatic. Often, the dynamics of close relationships can change. A partner can become a carer, or there can be a lack of communication between partners. Body image and sexual problems we've already touched on. Losses of health, body image, role, job, safety. Fears are also stressful, fears of a recurrence and about what the future holds. And the vulnerability of when treatment ends. It can seem sometimes like being abandoned by all the medical supports during treatment and regular appointments. Stress affects us physically, behaviourally, emotionally, and cognitively, and all of these are linked. Stress is exhausting, and tension can cause headaches and aching muscles. The stress hormones can cause digestion problems, a racing heart, and sleep problems, and behaviour is impacted. We may withdraw or increase alcohol or food intake as a way of trying to cope. Our mood is affected, as is our concentration, and our mood can fluctuate between high anxiety and panic or low mood. Lack of sleep can result in irritability and short temper. And then the negative thoughts are also impacted when stress is around. So it's important to find ways to cope in the middle of all these difficulties. A cancer diagnosis is one of the most difficult life experiences anyone can have to deal with and can be overwhelming. It can help to share your feelings. Who do you have that you can openly talk to about your feelings or situation? If you feel you don't have someone, professional help is available through your GP, other health professionals, and cancer charities like Cancer Focus NI. Don't feel that you have to be strong and struggle on alone. Friends and family are important, especially at difficult times. Often patients feel they don't want to burden anyone close, and yet loved ones can feel shut out by a lack of communication. Get good quality information from reliable websites and organisations or from health professions. Keep busy, but not too busy, so that your mind is focused on other things and you're not dwelling on uncertainties. Set achievable and realistic goals. Start with small steps and build on these. Often this can be encouraging as you move forward. Plan rewards when you achieve a goal. Say well done to yourself and be good to yourself. I'm sure you're familiar with how important these are, how important it is to eat and sleep well. Your body heals and is refreshed when you sleep, and also needs healthy nutrition. The advice is to go to bed at the same time every night, get up at the same time, have a bedtime routine where you wind down before going to sleep. Drink sensibly. Overdoing it may bring temporary relief, but it is a depressant and can lower your mood. It can affect your thinking and impact your medication. Be aware of your thoughts and how you speak to yourself. Often we can be harder on ourselves than we would be on anyone else. Ask yourself, would I speak to a loved one like that? Challenge negative thinking. Sometimes writing down the thoughts and looking for the evidence for them can be helpful. Solve problems as they arise and differentiate between what you have control over and what you haven't. Interests and hobbies help increase your confidence and interest and help you to connect with others. Make time for yourself. Chill out and relax. Ways of relaxing can include anything from music, pets, reading, crafts. Find something that suits you. Relaxed breathing is one of the simplest ways to relax your body and your mind. Imagine a balloon in your belly inflating and deflating as you breathe slowly in and out. Learn mindfulness techniques, prayer, yoga. All of these involve ways of meditating, and this helps our minds to slow down and to be more in the present. Be kind to yourself. Encourage rather than criticize yourself. Treat yourself the way you would treat a friend in the same situation. You might be surprised at how different that can be. Many support groups and classes are online at the moment, but they are available through cancer charities and on the internet, and it can be a helpful way to connect with others who have gone through a similar experience. Professional support and help is available to you from the clinical nurse specialists and medical staff, your GP, through counselling, the psycho-oncology service, and from Cancer NI free phone nurse line. Finding ways to live as much as possible in the present may be the best approach, although this is easier said than done. Living in the present moment takes some practice. So maybe start with living today. Ask yourself, what's important to me today? Yesterday has passed, and no one knows what will happen tomorrow. Really, all we have is now, and the more we live in the present, the better. A cancer diagnosis often makes people reflect on their life, reconsider their options, make new priorities, make or create changes, and reconstruct certain aspects of their lives. It's important to remember that cancer does not define you. It's a part of your life, but not your whole life. It may cause you to look differently at yourself and challenge you beyond what you ever thought possible. Thank you for listening.
Finding out that you or someone close to you has cancer can be a difficult and confusing time. But there is a Macmillan Cancer Information and Support Service based at a hospital near you to help you through all stages of your cancer experience. Our friendly, approachable staff and volunteers are here to support you if you've been affected by cancer in any way, or if you're a family member, carer, or friend.
We take the time to understand all that matters to you, so we can link you with information and support available in your area. Our experienced staff are here to listen to your worries and concerns, to help you make the feelings that come with a cancer diagnosis more manageable.
Receiving a cancer diagnosis can be an overwhelming time and can present a range of challenges. We offer emotional support and a listening ear, giving you the time and space to talk about any of your issues or concerns. If you feel like you need that extra bit of support, we can refer you to a counsellor who can help you with the emotional impact of a cancer diagnosis.
When waiting for cancer treatment to start, it's important to look after yourself. We can help with this too. We can provide tips and guidance on how to prepare physically, practically and emotionally for your treatment, and put you in touch with specialist services who can help. We will provide you with advice that will support you with your everyday living and the side effects you may experience with your treatment and recovery.
This is your journey, and we will provide you with information and support at every stage of your cancer pathway so that you're supported to live well. We help with the practical things, such as benefits and financial advice. We can also answer your work-related questions and help you access local services like transport or help at home.
We work closely with local and national charities so you know where to get the right help at the right time. They offer free services to help you live well if you've been affected by cancer, such as complementary therapy, support groups and support for children and young people.
Workshop and courses, both on an individual basis or in a group, can support you to manage the way you live with cancer. We can refer you to fatigue management workshops to help with any fatigue-related symptoms, and/or pamper sessions through Look Good, Feel Better to help you manage the visible effects of cancer treatment.
I came into contact with the information and support service when I'd just finished my cancer treatment. I was so used to going to appointment after appointment that afterwards I didn't know what to do with myself. I started to have a conversation with Martha, and just getting the time to release my emotions and having her there, being supportive, made such a difference to me. It was great to know what different support was available, and not just for me but for my husband and children too. I know the conversation lasted ages, but I didn't feel rushed to get off that phone, and to be honest, I needed the time. Having someone who can support you is something that cannot be bottled. It is precious. That phone call to Macmillan Information Service changed my life for the better.
Thank you for taking the time to watch this video. We're here for you, so please get in touch with your local information and support service. Contact details for a service near you can be found at the end of this video.
Hello everyone, my name is Karen Kelly. I'm the Macmillan Health and Wellbeing Coordinator for the South Eastern Trust. Myself, Gemma Ewing, our Assistant Health and Wellbeing Coordinator, Nicole Stewart, our Macmillan Support Worker, and our wonderful volunteers run the information and support service within the Trust. We are here on an ongoing basis to provide the information and support outlined to you in the video content that you've just watched. You can reach us by calling 028 90 553 246 or 028 95 98 0028, or by calling at one of our drop-in sessions, which run on a Monday from 9:30 to 11, a Tuesday and Thursday from 2 to 4 p.m, and on a Wednesday from 9:30 to 12 p.m. No appointment is necessary. We are based in the Macmillan unit within the grounds of the Ulster Hospital, and it's within the ambulatory care building on your right as you enter the hospital site. Please don't hesitate to get in touch. We are here to help you in any way that we can. Thank you.